We want to talk about allopathy. This is the type of medicine which most medical doctors practice. Allopathy means that they attack the symptoms. If you have a headache, they want to use a painkiller. This is kind of like driving home and you have the red light comes on your oil light on your car, and you put a painkiller, you just cover it with a piece of tape so you don't see that red light, doesn't glare in your eyes. This type of sense of attacking the symptom, covering up the symptom, is like shooting the messenger, where the actual symptom is a message of the deeper disease. In homeopathy and naturopathy, we try to look at the deeper disease. Chelier said that as stress enters the body, we go into an initial alarm reaction rich in symptoms. We might be exposed to a toxin. We might be exposed to excess stress, etc., work stress. This can create the sore throat. This can create the bronchial problem, the asthma, etc. If we continue the exposure of the stressor, if we do not relinquish the exposure of the toxin, the stress in our lives, we go from alarm state, rich in symptoms, to adaptation state, where we adapt to the stress exposure. This then is a place where the symptoms might go away. The sore throat goes away because we have adapted to the exposure of the stress. If it continues, we go to exhaustion state, where the body is exhausted and eventually dies. This is the progressive pattern of disease. We must realize that here at number 2, the adaptation level, no symptoms. You can be progressively getting sick and have no symptoms. Allopathy, which attacks the symptoms, is an inappropriate form of medicine. It does not deal with the body real. When we get exposed to toxins, the body needs to excrete those toxins. If we are exposed to those different chemicals, which we are every day and every hour, if we manufacture those toxins in our own body, which we need to release, if we are exposed to excess toxins, we will have excess excretion. If we have excess excretion, it might be diarrhea, sinusitis, skin irritations, etc. If we are then so unlucky as to go to an allopath, the allopath will mistake our symptom, the diarrhea, the skin irritation, the sinusitis. He will see that as the symptom, and he will attack the symptom, thereby driving the toxin deeper. This driving the toxin deeper is another problem with allopathy. Allopathy interferes by shooting the messenger, by not dealing with the adaptation states. We think that somebody who is symptom-free is healthy, and they are not. We must realize lack of symptoms is not a measure of health. We also need to realize that dealing with the symptoms might block the excretion. Allopathy is a bad form of medicine. It is an inappropriate form of medicine. We must now get into more ideas of homeopathy, where we look at the symptoms as messengers, where we look at the idea that the body might be dealing with stress, and that we want to go back and retrace the symptoms. In homeopathy, we want to retrace the ideas of where were they, so that we can release the problems, the initial stressors. And we want to encourage excretion. We want to realize if the body has diarrhea, it might be for a reason. If the body has a fever, it might be for a reason. To the homeopath, the body is smart. To the allopath, the body is stupid. We want to now get away from allopathy, a major bad form of medicine, and try to bring people to an awareness of homeopathy and naturopathy, nutrition, energetic medicine, and a host of other major types of ideas in medicine designed to take us out of the dark ages of allopathic symptoms, seeing people in crisis states, where we can move people to initial awarenesses, increase responsibility, make people aware and responsible of their own diseases, take people to a higher degree of awareness where they can start seeing the initial formations of illness, the initial formations of disease, deal with the initial factors, and create more harmonious balance, rather than the crisis design system of symptomatic attack of allopathy. So, in the making of these tapes, I wanted to try to express how a new form of medicine to replace the flawed system of allopathy. In dealing with the factors of responsibility and awareness medicine, we want to look at suppression, obstruction to cure. This is something I've made known as the SOC index. Samuel Hahnemann talked about there were ways that we could suppress the natural curative force or obstruct the curative force. We want to be able to look at these in light of responsibility issues so that we can understand how our behaviors, our ideas, and certain other things about us can interfere in our own ability to cure. It is our own bodies which are curing ourselves from all different types of disease every minute, every second, as we are in a struggle to survive in our environment. If we look at the SOC index, we're going to get a relative idea of some of the things and some of the ways that we obstruct the curative force. One way that we can obstruct our force is to remove organs. The adenoids, tonsils, appendix, thymus, spleen, ovaries, uterus, these are all needed organs, the gallbladder, etc. These are meant to be part of our body process. When we remove them in light of disease, it weakens the body's ability to deal with things holistically. We should try to save those organs rather than butcher those organs. Drugs is another thing. Allopathic drugs. In allopathy, when they are taking a drug to stimulate a function unnaturally, if they are blocking functions unnaturally, these different drugs are unnaturally suppressing the body's ability to cure itself. So allopathic drugs is another major way that we suppress and obstruct the curative force. There are many other ways that we can suppress and obstruct the curative force of our bodies. Smoking, definitely known to be a major cause of disease, as it interferes with the body's ability to cure. It interferes with oxygenation and transport and many other different things. Stress, excess stress, a major factor in disease. Alcohol, sugar, caffeine, trauma, not enough water, not enough air, not enough exercise. All of these factors will contribute to the suppression and obstruction to cure. We must be able to assay these with our patients and with ourselves. We must be able to look at this. Inside this CD, there's also the SOC paper, which will give you a little bit of light. Tell you a little bit more about this. As we do our courses in the Registered Wellness Consultant course, the RWC course, we explain much more about suppression and obstruction to cure. These are just some basic ideas as we want the patients to become more in touch with responsibility. There are going to be other little movies on this CD where I'll explain a little bit more about some of these areas. Addictions. The addictive mind, the addictive personality. This is something we need to also look at and address in our own lives. Is that everybody seems now in our society to feel that one or two addictions is okay because I don't do major drugs. But we need to be able to look at this. When something controls our life, even such as the need for sugar, addiction to coffee, addictions to stress, addiction to music, whatever it is, if it is controlling our life, this is something we need to look at. We need to see if it's separating us and creating suffering, etc. But most people get into some small addictions, especially for white sugar. They get small addictions for coffee. We need to be able to look at the addictive mind and help set free these addictions. In the QXCI device, there's a whole host of different release factors in the NLP program where people can utilize to release addictions to smoking, to sugar, as well as to cocaine, morphine, and a host of other different factors. So dealing with the addictions in our life, not just the major addictions, we think of the drug addicts, which is a major problem, that the QXCI can help, but also realizing that addictions in our small levels can need to be dealt with, and that releasing those addictions can really help benefit our lives.